In honor of World Sleep Day 2025, I would like to discuss how sleep affects our productivity and performance. I practice sleep medicine as a dentist in Ottawa, Canada. I offer tongue tie release with a water laze from infancy on up, as well as dentofacial orthopedics. Oxygen, as you know, is an essential fuel. We cannot survive without breathing, but did you know that the best way to breathe is through your nose, and that mouth breathing can actually cause serious health issues? Some of the issues are gaining weight. You might be snoring because you're not breathing properly at night, and that will disturb your partner. Some people actually sleep in separate rooms just because of the snoring. Did you know that getting up to pee at night can actually be indicating a sleep disorder at any age? Is your child waking up at night to pee? Do they wet the bed? Is your child waking up in a bad mood, or are they hard to wake up? Are you getting up to pee at night? You might actually have a sleep disorder. So if you remember nothing else today, remember, close your mouth and breathe through your nose. Tell me, is your tongue pressed up to your palate? If not, you might have a tongue tie. Are you breathing through your nose? Keeping your mouth open to breathe while you are growing as a child will shape your face. That child will grow to have a receded chin, a narrow palate, and crowded teeth. They will have bad posture, bad breathing, and bad sleep. Snoring. Snoring is not normal. Don't ignore the snore. It's not normal at any age. Snoring babies are not cute. It is an interruption in their breathing. It means somebody's taking a pillow and suffocating them every time you hear that. It means their actual brain development and growth is being interrupted. Snoring interrupts the brain's regular processes in children and adults as well. Children might appear to have ADHD from snoring and sleep apnea, and in fact, their entire personality can change once they receive treatment. Untreated sleep disorders in adults can look like high blood pressure, depression, mood disorders, heart attacks, and even Alzheimer's. So, what can you do here? Let's just finish talking about how much it can affect you. First of all, your brain is aroused. It's not actually waking up, but your nervous system is going into fight or flight every time you or your child or your loved one snores or stops breathing. So, how do we make sure that our jaws are growing properly? We make sure we breathe through our nose from birth. We have to check for and release tongue ties. A tongue tie can crowd your airway because it is unable to sit up at the palate, so it drops back into the throat. Well, the more you can't breathe, the more your sleep is disturbed, and the worse you feel both physically and emotionally. You're just not going to function well. And you may never think that it's your sleep that's the problem. So next time you hear a child or loved one snore or breathe loudly, or watch them wake up and go to the bathroom again, consider examining their sleep. If your child looks like the one on the top picture, make sure they get treatment. Now, the only definitive treatment at this time is a tracheostomy. It is performed in certain syndromes, but even those severe syndromes are benefiting nowadays from surgical treatments to grow the jaws by highly specialized craniofacial surgeons. I wanted to bring this to your attention because the back of your throat is part of your airway. And oftentimes people hear just take out their tonsils. Yes, if you have huge tonsils, you're not going to breathe well. And yes, take those big tonsils out, but you still need to make room. You still need to make sure those jaws grow properly. And you need to make sure that there's no tongue tie. So what can you do on your own to improve your sleep? Well, here's a lovely acronym. Sleep, sleepy time. Make sure you set aside a time that you know you're going to sleep. Don't wait till the last minute and just expect yourself to pass out in the bed. You have to wind down. need wind down time. So make sure that you limit your light exposure. Make sure that your environment is relaxing and cool. Make sure you prioritize your sleep. Exercise gently before bed. Let's talk about grinding your teeth. Did you know that grinding your teeth can be due to poor breathing? It postures your jaw forward, tenses up the muscles, and that opens the airway. It's a fight or flight response. Your body is lacking oxygen. Your brain is saying, breathe, breathe. And before you know it, you're tensing everything up. Just try to breathe. Just imagine every time somebody's putting a pillow over your face, and that response is going to be breathe. So that fight or flight response is that arousal, and that's why you are exhausted when you wake up in the morning. Imagine all the fights you've been in all night long just to try to breathe. So again, is it really a depression? Even heartburn? Don't wait. Do you have a mood disorder or do you have a sleep disorder? Remember, it is not possible to diagnose sleep apnea without an actual sleep test. In children, any loud breathing or mouth breathing is considered pathological, and they need to be addressed and seen by a specialist. So here you have the many different options for sleep apnea, mostly CPAP. Make sure that your mask fits comfortably. Make sure you use one you like. Make sure you get it regularly serviced. You can also see somebody like myself who specializes in sleep medicine and dentistry. We can offer all of these types of sleep appliances. There are more sleep appliances. What they do is just posture the lower jaw forward to stabilize the airway. They prevent the collapse of the tongue and soft tissue. And they make sure to prevent the airway from collapsing. There's also surgical treatment. The one on the left is called MMA surgery. It's maxillomandibular surgery, and you are advancing both upper and lower jaws. So they are actually cut on both sides and bringing everything forward. This I brought in just to show you how important, I can't stress it enough, to get children treated. It is urgent to treat children because their bones are soft. As adults, we need surgery to correct the problem. But in children, the bones are soft. They're still growing. This is the best time for treatment. I can make sure that they reach their maximum growth potential well before adulthood, which means I can also make sure that their brain development is progressing as maximally as possible because that's occurring during their sleep. So if their sleep is interrupted, they're not getting that brain development. Now, not always necessary to have surgical treatment. You can put in a rapid palate expander, in other words, as children, right? But as adults, you can't just put in a rapid palate expander, even though this one is just on teeth. So let me show you a surgical treatment for adults. That's a palate expander. Now this one has been removed, and you can see the red spots where the little implants were removed. It's held into the maxilla with implants, but it's far less invasive than that surgery I showed you